Welcome to our content for weeks 7 and 8. We only have one PowerPoint over these 2 weeks, and we're covering diabetes, which is a very heavy topic. So please be sure that you are going through the PowerPoint, asking any questions that may come up because the content is pretty heavy. We have a lot that we need to cover, a lot that you need to understand about anatomy, pathophysiology before we can actually dive into diabetes itself. So make sure that you ask any questions here or post into the discussion board for this week. And let's get going. So first, where does the body get its energy? Glucose. So glucose is the preferred source of energy for the body. Regardless, the body will take glucose and use it for energy pretty much immediately when we need to have some of that energy. In order for our brain cells to survive, they need a constant supply of glucose. If the blood sugar drops below 50, the brain cells actually become starved for energy. So as we get into the diabetes, we'll talk about hypoglycemia, which is low blood sugar, and what some of those symptoms are if a patient presents with low blood sugar. So we'll go over that a little bit, but remember, your brain cells are being starved for energy. So some of those symptoms will make sense as we're looking at what happens with that hypoglycemia. Glucose needs insulin, so it works with insulin in order to enter the cell. And then glycogenesis. That is one of these beautiful glyco words. You're going to see a couple of them, but glycogenesis is excess glucose, which is stored in the liver as glycogen. Basically, we have too much glucose that we've taken in. The liver's going to go ahead and store it. And then later, if we need some glucose and we're not eating, the body can go ahead and use what we have stored in there. The body also gets its energy from fats here as well. Fats are the main source of energy during fasting periods. So between the time you eat dinner and the time you get up and have breakfast, your body is fasting. So it's going to be eating up some of that fat to turn into energy. Burning fat produces ketones. So we all have heard of the keto diet. Ketones, when present in the urine, indicate that the body is actually burning fat in order to create that energy. And then another one of these great glyco words, glycogenolysis, is when the stored glycogen in the liver is broken back down into glucose. So you've got glycogenesis, where the glucose is stored in the liver, and then glycogenolysis, where that glycogen is then broken down to become glucose. And then finally, we also have protein. So protein is actually not a preferred source of energy because of the fact that it's more complex and it takes longer to break down, which means it's longer lasting, but it's not going to give that initial energy surge when the body needs it. And then so this one is not a glyco, this is a gluco. So gluconeogenesis is when protein is broken down within the liver to then make glucose. So if you take in protein, your body needs energy, and you take in protein, it will work and it will become energy, but it needs to go through the gluconeogenesis process first and be broken down and made into glucose.